My fellow Guyanese, welcome to today's COVID-19 update. We are returning from a weekend, and I hope that you took the time to reflect on what was asked of you during the past week. We are in the 11th week since our index case, and from the updates provided, you are aware that our numbers have increased. Also, that the hinterland regions 1 and 7 have had an exponential growth in positive cases. Region number 5 is one of the regions that has not reported any positive cases, so we remain with 7 regions out of 10 with COVID-19 cases. With us today is Dr. Desmond Nicholson, Regional Health Officer, Region number 5, Mahika Berbice, who will be providing an update of his region's preparation. Dr. Nicholson?
The Department of Public Health of Region 5 has taken public health countermeasures to stop the transmission of the COVID-19 virus. These measures also ensure that our healthcare system does not become overwhelmed by a surge of COVID-19 positive patients, and they also buy time for the development of medical countermeasures such as medicines with greater efficacy against the virus, vaccines, and even a cure. The countermeasures are public health surveillance. Surveillance is the backbone of public health. Our strategies include early screening, rapid diagnosis and reporting, case management reporting, contact investigations, and the monitoring of trends. To this end, we are involved in robust surveillance reporting and follow-up of each case of acute respiratory illness from all health institutions. This is done through the Regional Health Emergency Operations Center Surveillance Team, which shares its data with the Department of Epidemiology of the Ministry of Public Health and the Health Emergency Operations Center on a daily basis. Checkpoints. 3 checkpoints have been established to screen persons entering the regions from regions 4 and 6. All commuters are screened for elevated body temperatures. This allows for efficient screening, early isolation, diagnosis, and treatment of COVID-19 positive patients. Institutional quarantine. We have established a quarantine facility at the Experiment Health Center. It has a capacity of 22 beds and allows us to safely quarantine those residents who have been exposed to COVID-19. These patients will be monitored daily by our team of medical professionals who will provide the highest level of medical care to all patients at the facility. Institutional isolation. Separate wards of the Maikoni Hospital have been designated for the isolation and proper management of COVID-19 positive patients. Efficient laboratory practices for sample taking and testing. Currently, 6 staff have been trained in sample taking. Testing is done at the National Reference Laboratory, and the turnaround time for results is 24 hours. Social distancing. The department continues to advocate social distancing of at least 6 feet between residents. Hygienic measures. Frequent hand washing is encouraged. There has been installation of hand washing stations at all health facilities, offices, businesses, and other places where it is observed that residents congregate. There is also bi-weekly sanitization of markets, health institutions, and public offices. Use of the face mask. Each resident is advised to use a face mask in public, especially when social distancing cannot be achieved successfully. Continuation of routine services. To ensure a continuation of routine services, we have made strategic shifts relating to staffing at our facilities to ensure that our limited resources provide maximum benefit for the population. Curfew. All residents of the region are encouraged to observe the national curfew. Do not forget to call our hotline numbers in the event that you suspect you may have COVID-19 or may have been exposed to COVID-19. These numbers are 624-2000, 624-9000, and 640-3000. Finally, staff must comply with the highest standard in precautions, especially in hygiene practices, and are provided with adequate supplies of personal protective equipment to protect them from becoming infected with COVID-19. The department urges all residents to observe the national public health guidelines as we work together to defeat COVID-19.
Thank you, Dr. Nicholson. Fellow Guyanese, you have just heard Region Number 5 update. We are aware that persons residing in the regions where cases have not been reported are taking this situation for granted instead of taking all the necessary precautions to protect themselves. We continue to plead that your only protection is ensuring that you wear a mask, maintain physical distance if you are in public, but most importantly, follow the curfew and other measures that the ministry has in place. Residents of Regions 1 and 7, and most importantly, those who are from the mining communities, we ask that you continue to be vigilant and be forthcoming with information that is necessary for us to be able to contain the spread of this disease in your communities. Persons experiencing the signs and symptoms of this disease are asked to contact the hotline if you can, or the closest health facility, so that we can visit you and provide the necessary services. This is also being asked of all who have been in contact with someone who was tested positive. We call on all other agencies and community groups to reinforce the guidelines to all residents. Reports of discriminatory acts continue to be forwarded to the ministry, and we are very disheartened to hear this. In this time, when we should be our brother's keeper, we are turning him away. COVID-19 should not take away your humanity. The situation in Guyana as of the 1st of June 2020 is as follows. As of today, of the 40 tests done, there are no new cases. Our COVID-19 deaths remain at 12. The number of confirmed cases remains at 153. To date, the total number of persons tested is 1,658, with the total number of negative cases being 1,505. We currently have 70 persons that have recovered, 71 active cases in institutional isolation, 2 patients in the COVID ICU, and 23 persons in institutional quarantine. Now for the global report. Globally, the statistics according to WHO are as follows. Total number of cases is 5,934,936, with 367,166 deaths. In the region of the Americas, the total number of cases is 2,743,793, with 157,702 deaths. We continue to ask residents to desist from crossing the borders as Brazil continues to record new cases every day. However, I ask that we pray for guidance for their health workers who, like ours, and those in every other country, stand in the front line as our brave heroes. Thank you for joining us last evening as we saluted our heroes of the war against COVID-19. We also wish to thank PAHO for hosting this virtual concert in solidarity with all our frontline workers. We commend those of you who are making a special effort to do your part in this crisis and reiterate the need for all Guyanese to come on board and take on the responsibility for your life and that of your family. God bless you. Stay safe and healthy. Thank you.